Laser skin resurfacing, which I've shown in several of these pictures, is still a good procedure for more advanced degrees of sun damage. The CO2 laser I still own. I've had one since 1990. It's in the operating room. This is an operative procedure because we do remove the surface of the skin, we tighten the skin, and the new skin heals in. And so here's an example of a patient with bad sun damaged skin, lots of wrinkles, lots of pigment, and then she's 2 months out from the laser, which has tightened the skin and smoothed the skin, eliminated about 80 to 90% of the sun damage and pigmentation. This is a one-time only treatment, and the results are quite dramatic. It does take about 10 days for the new skin to heal. So as opposed to the in-office laser with no downtime, this one, you do have about 10 days to get the skin healed. I don't recommend this for mild degrees of sun damage because we can improve that with skin care and the light lasers. But severe degrees of sun damage like this, where there's just very bad sun damaged skin, lots of wrinkling, we can really get nice results with this. And we still perform a couple of these a month because that is a common problem with all the sun we get and living longer. Bad sun damaged skin is apparent. So a good treatment for the right patients for that rejuvenation of the skin.
This patient didn't have any cutting, no incisions. Laser?
She had her upper eyelids done. I took out some of the extra skin, but that's it. We did not do a facelift. That's correct.
No general anesthesia?
No, this is all done under IV sedation. Yeah. Everything's done under IV sedation. They used to call this procedure the facelift bypass because it tightened the skin so well and make you look like you've had a facelift. But the reality is facelifts are done for, jowling, neck laxity, looseness. And there are a lot of patients like this where we would do a facelift first and then we would do a laser as a second procedure. It's too much to do them both on the same day. In the very beginning we used to do them together. Sometimes they were a little slow to heal, so we stopped doing that. We do the facelift first and the laser second. In her particular case, we just did the laser. The skin tone was pretty good. You can see she doesn't have a lot of jowling or neck laxity. So the laser was the key thing for her to tighten and smooth the skin.
I thought when you had laser done, your skin was all red afterwards.
Well, it can be pink for a bit. I mean, she's about 2 months out now, and most of it's faded. You can see that it's lightly pink here. But yeah, you'll be pink for a bit. It takes about 10 days for the skin to heal.
You're saying pink, I'm saying red.
It's not if you treat it properly. There's a right and a wrong way to do it, and a lot of people didn't handle, when this first became popular in the 90s, a bunch of people bought lasers, but they weren't committed to doing it the right way. They would do laser treatments, send people home, tell them to use Vaseline, come back in a week. That's not adequate. We use protective dressings over the skin, which helps the skin heal faster and reduces the amount of redness you have. So everybody gets some redness with a full face laser, and that can fade anywhere from a couple of weeks to several months. But by the time the skin is healed, which is usually 10 days to 2 weeks, then you can use light makeup if you need to. Most people find it looks like a mild sunburn and they just don't use makeup, and it fades over several weeks' time. Yeah, so it goes away. The redness you get from full face laser resurfacing is not permanent. It's temporary, and it can be anywhere from a couple weeks to a couple of months depending on your skin type. That's the main thing. Fair-skinned people like me who are ruddy in complexion, I'm red forever. If I have, surgery, my incisions are red for a year. So if I had a laser, I'd probably be, pinkish for several months. But thicker skinned patients with more pigment in the skin, it fades much quicker, sometimes in 2 weeks.